We've got Tom here. I'm just going to demonstrate how to go from an acute lower back to getting a bit more range of movement, and then some more strengthening exercises at the end. So we're just going to start with some gentle lumbar rolls. What you want to make sure you're doing is keeping those shoulders on the ground. From here we're going to move into the cobra. So with this one you want a nice extension through that back and lifting that head up nice and gently and coming up 5 to 10 times. From here we're going to move into the glute stretching. So glute stretching you can do 3 different ways. So you can bring that knee straight towards your chest, you can bring it then across towards the opposite shoulder, and from there you can put that knee onto the opposite knee, that foot onto the opposite knee, and bring the knees towards the chest. With these group of exercises, it would be ideal to do a 10 to 15 minute walk 1 to 3 times a day as well. And then moving on to the subacute exercises, adding in a bit of strengthening. So you're going to start with some bridges. So with these ones, we're aiming for about 30 seconds, keeping that back nice and straight. From here we're moving on to the side bridges, so doing both left and right sides. Somewhere between 15 and 30 seconds would be brilliant. Trying to keep that body in line again. From here we've got the bird dog. So with this one we're lifting up the opposite arm to opposite leg, again keeping that spine nice and neutral. So we're repeating about 10 on each side. And from here we've got some glute bridging. So with your glute bridging you want some control to begin with. So squeezing those glutes as you're coming up and getting into a nice straight line. So 10 to 15 of those. In this subacute stage we do want to get some range of movement happening as well. So from here we'll move on to some seated flexion. So you can either use a chair at home, a box, or one of these fit balls. So you're just gently running those hands down the legs, or arms down the legs, so you get a nice curve through that back. So once you get to that bottom, you really want to let that stomach go and feel a nice pull through that lower back, and then gently creeping those arms back up the legs. In this subacute phase, we're looking at about a 30-minute walk as well. From here, we're going to move on to getting some strength and function back into this lower back. So I'm going to start with some kettlebell swings. So you really want to get that hinge happening from the hips with kettlebell swings, keeping those arms at about 90 degrees. A fantastic exercise for the lower back. And again, 10 to 15 of these would be brilliant. From here, we're going to move on to some deadlifts.
Box squats.
Box squats first. So with that same kettlebell, you're looking at sitting back onto your chair or your box at home. So you're making sure those knees don't come past those toes. Doing about 10 to 12 of those. And then finally we've got these deadlifts. So you want to keep that back nice and neutral, that chest up, making sure you don't extend too far through that neck, and a nice controlled movement.